Hi, I'm Anu, author student of UTS studying Bachelor of Nursing. In this video, I'm going to give a quick presentation about how patient safety and a health workplace are interlinked with manual handling. Before talking about the interconnection between all, I would like to start with the definition of manual handling. Manual handling means supporting or transporting the load, where the load can be an object or a person. When relating to nursing practice topic, manual handling means handling the bariatric patient or high care patient with the use of appropriate equipment and appropriate technique. What is the problem? Nurses are the one who needs to handle obese or high care patient in their daily basis. Nursing is the one of the profession with high demand, extreme risks, and a high stress industry in unending changes with unique well-being and safety challenges. All healthcare workers needs to be able to transfer the bariatric patient with proficiently and securely. And sometimes it will be difficult to find out the correct equipment for them. Patients might feel hesitant if staff will not be able to give proper care, and staff can be harmed when attempting to transfer patient without the best possible equipment. This can bring about sentiments of mortifications for the patient and dissatisfaction for staff. Besides, staff frequently experience fatigue when managing the disappointment around this. Why is it a problem? Related to patient. Moving patient with unsafe practice can cause skin laceration, bruises or tears, breakdowns or pressure injuries to the patient. There will be high risks of fall, risks of bodily injuries such as ribs or bone fracture or other musculoskeletal injuries to the patient. Related to healthcare workers. While trying to lift patient without the use of manual handling, healthcare worker might be suffer from work-related musculoskeletal disorder. Moreover, back pain or other chronic health problems, physical and mental stress are some of the other problems that might be occurred in healthcare workers. Along with that, medical error can be occurred because of physical and mental stress. Likewise, if healthcare workers will try to do daily care of the patient without the use of manual handling, it will take longer time to care one patient. Why is this issue important? For patient safety and for staff safety. According to Safe Work Australia 2018, serious claims of musculoskeletal issues from 90% was made, with widely recognized awful muscle ligament injury and joint tendon injury, particularly 45% in 2014-15. Similarly, in 2014-15, nearly 6% of claims were made for mental issues. Between 2000 to 2001 and 2013 to 14, time lost because of the issue claimed increased by 33%, which is from 4.2 to 5.6. This kind of issues can be life-threatening to the patient and can be career-ending for the healthcare workers. Using of hoists, slings, slide seats, forearm support frame are some of the examples which the healthcare can use to reduce risk factors. This kind of equipment can help to reduce the risk of bodily harm for both patient and the care provider. It will help to utilize time in a proper way. Similarly, it will help to build trust between patient and the staff. Regardless of having idea about the importance of waste, 41% of the 134 health workers who reacted to the survey in 2015 told that they have never or once in a while used them, which means lots of healthcare workers and patients are in risk of having medical issues. Giving proper education and training about the manual handling can be helpful for the staff. The organization can provide education to the staff about using technique, importance of using those equipments. Positive attitudes about the equipment can play a vital role to reduce risks of the injuries for both patient and the staffs. And before using those equipments to the patient, it is very important to get permission from the patient or patient's family to try to engage them as well if possible. Before using the equipment, all the healthcare provider needs to be sure about the patient's health condition. Identifying the risks and making the action plan for that is the first step of caring patient. Healthcare provider needs to identify what is the problem of patient, find out which equipment will be effective to use for that patient, and then find out if they need support or help of other person or not. Identifying the risks and working with that needs before starting the procedure will help to reduce risks. For example, while using hoist for the patient who is 90 years old and 115 kg weight, nurses or any healthcare provider needs to make sure that if they need support of someone else or not. If S asks for help before starting the procedure, once all the equipments are ready, once all the environment is safe, discuss the procedure with other staffs and with patient, then only start the procedure, which will help to reduce risks to the patient and the care provider. Role of effective leadership. To be a role model and guide the team member is the foremost role of team leader. Motivating and supporting the co-workers, allocating tasks and setting objectives, clarifying the methods of work, delegation network are the key responsibilities of team leader.